test. All right. James, thank you for joining us today. So we are going to be going through a variety of special tests. They are called our upper limb tension tests. There are 4 of them that we are going to be performing today, and these are special tests related to the upper half of your body. So the purpose of these special tests is to go ahead and assess to see which nerves are involved in your dysfunction that you're experiencing. And to perform these special tests, I am going to have to place my hands contact on your shoulder, around your whole arm, wrist, hand area, and then I will be instructing you on making motions of your head and neck. Okay, as I mentioned, the purpose of this is to go ahead and give me information related to which nerves are affecting your condition, but there is a chance we will probably elicit some discomfort with these special tests, so if you feel discomfort at any time, numbness, tingling, sensations down into your arm and hand, please let me know and we can modify our special tests accordingly. But hopefully it'll give us information regarding your condition as well as developing an appropriate treatment plan for you. Do you have any questions about what we're going to be doing today? Do I have your permission to continue? Thank you so much. I'm just going to go wash my hands quickly. So we are going to start with upper limb tension test number 1. Wakey, wakey.
Yes.
There it is. Got it. And
Stay
it's
there.
I'm not allowed to watch the demo at all.
all right. So upper limb tension test number 1. The nerves associated with upper limb tension test number 1, or the purpose of upper limb tension test number 1, is to apply stress and tension on the upper aspect of the brachial plexus. So your most upper nerve roots will be affected. Now keep in mind, this upper limb tension test is going to be used to tension throughout the entire course of the nerve. All right, so these tests will tell you which nerve is affected, and how you apply this special test can actually tell you where the lesion is. Okay, we'll talk about that in just a second. So first and foremost, you will notice that I actually also have the photos up there for you, as well as the specific description of how to do this special test. All right, do you know if one side is tighter than the other? Probably your right side. Yeah, okay. So of course we would perform this special test on the unaffected side first, just to see what the baseline is, because even though he doesn't have any nerve lesions of the upper limb, because he is a very active individual, he's got a lot of tightness in those structures, which means tightness can trigger restriction in those nerves. So even though an individual may not have a nerve lesion, they can still test positive for these special tests, which James and I already anticipate he's going to test positive for a few, if not all of them. Lucky you guys, get to see a real positive. All right, so shoulder must be had at 110 degrees of abduction with depression. So with this one, we do not need to incorporate an element of shoulder extension with this one. Elbow is going to be fully extended. We are going to have full supination of the forearm, which helps with that there. Good, and then the wrist and fingers are going into full extension. So this is when we're going like this and like this, okay? So the thing is, if somebody has a nerve lesion, we're not going to go kaboom, 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 right? We're gonna go nice and slow, right? So the idea is we are gonna go in order. First, we are going to depress that shoulder. Okay, we know that we are going to be bringing him into extension of the wrist and the extension of the forearms. So I like to take up the slack here, making sure we are up at that 110 degrees. If I have his consent and we have a barrier here, I could potentially use myself to actually keep his arm up there. Do I have your permission to use my leg for that? Perfect, thank you. Okay, so just to make sure we stay in that 110 degrees. So here, we're going into full elbow extension. And then the last step is, James, I'm gonna get you to laterally flex away from me, please. He doesn't want to, it's already a positive. What type of sensations are you feeling?
Tingly, pulley.
Okay, so that's already a positive that he's experiencing. All right, to remember the positioning for this upper limb tension test number 1, we like to say, talk to the hand. I don't want to hear it. I don't want to hear it. Right, so that's our upper limb tension test number 1, talk to the hand. Okay, hand. They're even turning away from it, talk to the hand. Right? whatever applies the most tension on the nerve. So slowly, you'll be slowly turning it into supination with it as well too, right? So that is all the end goal positions for you. Tissues we are stressing include the median nerve, including the anterior interosseous branch of our median nerve. Anterior interosseous? No, that'd be the radial nerve. Anterior interosseous. Which one is that? That's median, right? Yeah, I thought so. It's median. It's a branch off the median nerve. Anterior interosseous. Yes, it is. And the palmar cutaneous. Yes, it is. Got it. We got it. We got it. Median nerve and anterior interosseous nerve. Okay. So upper limb tension test number 1 specifically tests the most upper components of the brachial plexus, the most superior aspect of the brachial plexus. C5, C6, C7. Okay? Now we got upper limb tension test number 2. So this one was talk to the hand. This one here. I just gotta snack it once in a while. It's fine. What are you doing? Okay. Now for this one, there is a slight difference. He needs to actually come off the table a little bit for this one. So I'll get you to move over a little bit. Because not only are we going to abduct and depress the shoulder, but it's also going to come back in extension as well too. Now this one is to be kept at 10 degrees, which means minimal abduction, right? We're going to depress that shoulder and it's also going to be brought back into extension. Now this one in particular is the tip the waiter, is the position that you're going to have them in. Okay? So that means I'm going to do the shoulder aspect last, but he is going to be in elbow extension. We've got supination of the forearm. Oh, I'm thinking of the wrong one. So this is throwing the tip away. So number 3 is the waiter's tip one, but then you see that, oh, that's a terrible tip, so you throw it away. So that's this one. You throw the tip away because you don't want it. I don't know who would do that, but that's just how we remember. There's waiter's tip, and then we throw it away. Very similar, except one is going this way, one is going that way. So that makes sense. Yes, it is going to be supination. Extension, extension, depression, minimal abduction, supination of the wrist. We are going to go into extension and extension, but I do want to implement that little bit of shoulder depression as well too. So I'm going to do the extension of the elbow last.
Is that still 10 degrees?
I'm going down into it. Good, right here, we're okay? Good, and I'll get you to go ahead and head off to the side, please. Good, pain or discomfort here?
No.
Yay, he doesn't test positive for this one, yay. All right, so based off of that pathway, we are brought down here, going into here, and getting him to go, ooh, I test positive, okay. What nerves are we challenging, considering we are stretching through this anterior aspect?
Radial?
Again, it has to do with the median nerve, but as well as the auxiliary nerve and the musculocutaneous nerve. So this is another one for the median nerve, but it is a little bit lower down in the chain. It's okay. So if you actually take a look at our pictures that we have of the brachial plexus at each of the intervals where we were introducing the nerves, you will see how having the downwards traction is targeting the median nerve, while still this one is also targeting the median nerve. Okay, so that was the way I was able to correlate which one was which, was I was actually looking at my brachial plexus to be able to see the difference there. Okay, so upper limb tension test number 1, talk to the hand. Upper limb tension test number 2, what kind of tip is this? Right? What is this tip? We'll call it that. Upper limb tension test number 3, I really wish they did this in opposite order because it makes more sense. The tip the waiter and then throw it away. I would like them in the opposite direction. Now, this is where it gets kind of confusing for you guys, because believe it or not, there's a typo in McGee. Oh, wow. And it is the most inconvenient typo ever, because it's supposed to be abduction at 10 degrees, and in McGee it says 110. I can confirm that it is a typo because in an older version of McGee, it says 10 degrees. As well as I went to the source used in McGee, and it says minimal abduction. So I did a deep dive to see if I could find out what the right answer is for you guys, and it's supposed to be 10. You can also tell by the picture. So here is our, go back, come on. Come on. Please work. Is it too far?
Would you like me to try?
Oh, there it is. Okay, so you can see, whoopsie, too far. This is our upper limb tension test number 2. And the only thing that changes from upper limb tension test 2 to 3 is the wrist. So both of them are 10 degrees of abduction. I know it's terrible that McGee has a typo, but it is supposed to be 10 degrees of abduction. Okay, so if he threw away the tip, he's getting tipped with a better tip this time. So it's going to be everything exactly the same. We're going to go into shoulder extension, minimal abduction. Eventually we're going to depress that shoulder, but instead of him opening and going this way, we're going to get him to pronate and close his fingers this way. So the mistake I see often with students and this special test is they do not close the fingers as well as the wrist. Okay, so it's not enough to make sure you just do this. We actually want to see you purposefully bring those fingers in. Okay, just going into the wrist is not enough. We want to see you bring in the fingers. Okay, this is not enough. We need to see this. Okay, good.
I feel the difference too.
You feel the difference. And we haven't even brought him into lateral flexion, my poor guy. Are you okay with us continuing? Are you sure? Do you want us to do the other side?
No, it's fine.
Oh. Just asking. Right? Okay, so we know it's going to be like that. And again, I like to do the shoulder depression component last because believe it or not, it makes a huge difference when you depress the shoulder and when you don't. So depression, and I'm going to bring him into, you okay? That, his face says no. I'll get you laterally flex. Any sensations?
Yes.
Probably 3 steps ago. You can go ahead and back off. Good. Was it the sensations down? Where did you feel it?
Just here.
So you felt it all the way down. So he's feeling it down at radial nerve distribution. Which nerve do you think we're testing? The radial nerve, right? Because of that tuck, 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 we are literally trying to stretch out that radial nerve as far as it'll go. Make sense? So there is our tip the waiter. We went through our, what is this? And then we did our talk to the hand. And then upper limb tension test number 4 is the, what did you say? I can't hear you. All right, so for this special test, considering it is going to be taking up slack along here, along here, along here, and along this outer side here, which nerve do you think we're testing with this one? The ulnar nerve. So if this is upper limb tension test number 4, and upper limb tension test number 1 was testing the uppermost brachial plexus, what aspect of the brachial plexus do you think upper limb tension test number 4 is testing?
Lower.
The most inferior aspect of that brachial plexus. CAT1. You got it. All right, because you can imagine, lower aspect, when we're bringing the arm up like this, you can see how tension would be applied on the lower aspect. All the other ones were coming down here and he was laterally flexing away. That'll stretch the upper aspect. But if we're coming up and around this way, you can see how it would stretch that inferior aspect of the brachial plexus. Right? Kind of, sort of? Cool. All right, so for this one, he does not have to be off the table. Okay, go ahead and move on to the table for me. So 1 and 4 do not need that shoulder extension. 2 and 3 need the shoulder extension. Okay? So from here, again, depression of the shoulder, abduction, paramount. Okay, I'm going to do those aspects last. We know we are going to be in supination. Pronation is right. So you'll notice I put pronation in red words there. In McGee, it says supination or pronation because I guess they couldn't agree on which way the wrist is actually turned. It is pronated because if you supinate the wrist and bend the elbow, it brings the hand facing you. But if you pronate the wrist and bend the elbow, the hand is pointed away. So that's the reason why it is a pronated forearm that is brought back into full elbow flexion. Okay? And then we're going to extend the wrist and extend the fingers. All right? So that is what we are going to do here. We're going to do this. And again, James, is it okay if I use my leg to brace against your elbow? Good. So we're going to go up here. We're going to depress that shoulder, make sure he's up at that 110, and come back this way, like this. How you doing? Do you feel sensations? You do? Are you comfortable with laterally flexing? Okay, laterally flex. Good. Any sensations there, James?
Yes.
Yes, he felt it forever ago. Okay, so if by chance he did not feel any sensations until he put his head over, then great, you can go through all stages. But let's say I get to about here, I get to here, and he's like, oh my God, sensations. Do I have to keep going? No, that already tested positive. All right, just to confirm, if he tests positive early, where are you feeling that sensation? Some people might just say, it just feels tight, in which case, are you comfortable with me continuing with the rest of the special test? Because that is technically not a positive, right? So when they say, ow, pain, what kind of pain is it? And do I have your permission to continue? Make sense? Okay. So now the difference between applying it down the arm and getting him to apply lateral flexion will tell us how far up the chain he is experiencing sensations or is experiencing dysfunction or a lesion in the nerve. So if I were to go ahead and put him in this position and he doesn't feel anything until he laterally flexes, well, what aspect of the nerve pathway, the upper portion or the lower portion, is applying tension when he laterally flexes his head? It's at the nerve roots in the upper portion, right? So if he's experiencing sensation like, oh my God, pain, sensation, and we have not necessarily done the lateral flexion component, then that means the lesion is likely somewhere else along the pathway. If he's fine, he's doing fine, he's wonderful, he's fine, then he laterally flexes and he's like, ow, pain, then we know it's probably because the lesion is actually closer to the nerve roots. Okay, so that lateral flexion component is specifically to see how far up that nerve lesion might be, because it takes out the rest of the slack in the chain. The motions I am applying with the hand will be testing further down on the chain. So if you wanted to see how far down that is, you could do the same thing. You can start here, apply lateral flexion first, then depression and abduction, and then extension, or I guess this one's flexion, pronation, extension, and extension, right? So one, going down the chain is assessing down the chain, but if we go backwards and we do this one, followed by this one, followed by this one, followed by this one, followed by lateral flexion, then we're tracing it back up the chain. Does that make sense?
Yeah.
So you can actually identify where lesions are with these special tests. Is it super duper, super accurate? I mean, like, it can be. But also if it's like, we have a scar right here, then do you need to be able to necessarily trace exactly where the lesion is if you can see that there's a lesion, as well as that's where his sensations are starting? Not necessarily, right? So that's just showing you how to utilize the nuances of these special tests. All right, so for the purpose of these special tests, know how to conduct them, which nerves you're testing with them, including what aspect of the brachial plexus you will be testing with them. Okay, so I would like you to please partner up with somebody, preferably somebody you haven't worked with in a while, and I'd